A warm welcome to you from wherever you are joining us from. Let us begin with the Democratic Republic of Congo, DRC. Health officials there say they will begin administering an experimental vaccine following a new Ebola outbreak last week. The drug was previously successful in containing an outbreak in the northwest of the country. The new outbreak began last week in the eastern cities of Beni and Mangina. So far, 13 cases have been confirmed and 3 deaths registered.
I would like to add that the new experimental vaccine produced by drug manufacturer Merck was successful in containing a similar outbreak less than 2 weeks ago in the northwestern Congo. Beni's Ebola response director Bat Njokolo Tambwe said the vaccination will be given to healthcare providers, confirmed Ebola victims and those with whom they have been in contact. Congo has 3,000 doses of the vaccine in stock, and health workers are keeping a cold chain to keep them well below freezing.
De froid très méticuleuse afin de les garder au-dessus du point de congélation.
Omar Kavota is from a civil society group based in Beni, one of the cities affected by the new outbreak, and he is with us now. Omar, the city where you're based, Beni, is facing an epidemic of Ebola that has already claimed some lives. What is the state of mind of the population at the moment?
Il faut dire que la population de Beni vit dans une sorte d'anxiété.
It must be said that the population of Beni lives in a kind of anxiety because you know that this population is confronted with growing insecurity as a result of the negative forces of armed groups. And it is the western part of Beni which seems to be more or less secure. But here, against all expectations, this terrible Ebola epidemic is occurring. So there is a lot of anxiety, fear, and it's at the same time a kind of discouragement that can be observed in the population following this new epidemic.
Une sorte de découragement qui s'observe au sein de la population à la suite de cette nouvelle épidémie.
So, what has been the government's reaction, especially since the announcement of this epidemic?
On doit se féliciter de cette promptitude du ministère national de la Santé.
This promptness on the part of the National Ministry of Health is to be commended, because just after discovering that it was this terrible epidemic, the minister himself moved from the capital with a strong team of experts. And a response coordination committee has been set up to come to the people and persuade them, to comfort them, and even to try to contain this epidemic.
Et même s'employer à endiguer cette épidémie.
So it is at this level that there is hope, insofar as there are strong teams who are already on the spot with a wish to end it, and already public awareness campaigns have been undertaken by these teams beyond the medical care that is being provided to the already identified victims.
Au-delà de la prise en charge médicale qui est en train d'être assurée aux victimes déjà identifiées.
Omar, you belong to a civil society group, and in such instances like this, what is your role?
La société civile dans son ensemble, en tout cas, il s'observe que les uns et les autres sont mobilisés pour agir dans le cadre de la campagne de sensibilisation.
The civil society as a whole, in any case, is ensuring that both are mobilized to act within the framework of the awareness campaign, which is also part of the strategy of response against this epidemic. There is therefore this appropriation of this campaign, which is being carried out at all levels within the strata of the population, and the living forces are effectively mobilized to try to speak about it as much as possible to the community, so that hygiene measures are observed, so that panic is deterred, so that finally the population can understand that together we can manage to contain this disease.
And what more will you have to do to reassure the population in Beni and elsewhere?
La population voudrait que le vaccin arrive le plus tôt
The public would like the vaccine to arrive as soon as possible and the whole area to be under surveillance so that we can get out of the situation, because there is a kind of psychosis and panic on the population when they learned that it was the Ebola virus. We believe that with the intensification of the campaign, there is need to adhere to this response, that those beliefs that could take up residence be really pruned, and that both of them work to observe hygiene measures. And on this subject, we are now delighted that the population understands that it is indeed necessary to increase hygiene measures, that it is necessary to bring towards the medical structures all the suspect cases, and also to work together to help the medical personnel to stem this virus. And so we hope that we will be able to contain this disease and prevent it from spreading as far as possible.